Wilson,
And I'm Benjamin Day.
and this is the Medicare for All podcast, the podcast for everyone who needs healthcare. Hello, everyone, and welcome. Hope you're all doing great today. I'm here with Benjamin Day. How are you, Benjamin Day?
I'm doing okay. I need some health care. I'm ready for today. I need all the health
Yeah,
care,
that's
man.
how.
I'm getting old.
Any particular kind of healthcare you're hoping for?
Well, they
No,
just
don't
put
say it
me
out loud,
on.
actually. If you say it out loud, it won't come true. Sorry, go on.
Okay. I'll just hold my wish internally and blow out the candles.
JK, what were you going to say? What do they got you on?
They just put me on blood pressure medication. So that's lovely.
Oh, wow.
Mhm.
Welcome to middle age, my friend.
Yeah. I've either got hypertension or some terrible, terrible underlying disease causing high blood pressure. We'll
Oh,
wait and see. Yeah.
for those of you who are listening and not watching, both of my fingers are crossed. I'm
Mm.
hoping one doesn't undo the other.
Well, that'll
All
work.
right.
Yeah.
Okay. Well, we'll blow out the candles and wish for Ben to not have some crazy disease
Mhm.
and just have hypertension like the rest of us.
Yeah.
Yeah.
That's what we can all wish for, really the best.
That is fantastic. Thanks for asking. I'm having a great day too, Ben.
How are you doing, Jillian?
I actually am super good. And one of the reasons is actually because later on in this episode, we're going to be playing an interview that I got to do today with Cleve Jones, the legendary activist who
Very
invented the AIDS Memorial Quilt. So I'm really excited to share that conversation with folks. But
Awesome.
first, you know what we've got. Big healthcare news.
All right, hit me with it.
All right.
I have to admit, I had not had much chance to see this news, so you're going to get my real-time live reaction. So
That's
for
fantastic.
better or for worse. Yeah. I try to avoid the healthcare news as much as possible. So
Craig, our audio editor, will edit out the part where you said that you don't know what you're talking about.
yeah.
No, JK. Your expertise will certainly be enough for this because much like history, things in this country happen first as tragedy and then as farce. So this will all sound really familiar. So I feel like maybe now that we're doing the news on a regular basis, we maybe should just like reserve a spot for RFK, like every episode.
Yeah, and in fact, somebody could sponsor the RFK segment of each podcast.
RFK Watch, brought to you
Yes.
by.
Exactly. Yes.
That's great. Yeah, advertisers, if you want your name there, let me know. Just hit me up.
What's he done now? Tell me.
Jeez, he just keeps fucking it up, Ben.
Mm-hmm.
So now he's fucking with this interesting thing that I think that a lot of people don't know about, and that's why I thought maybe we should talk about it here. But it's the U.S. Preventative Services Task Force.
Okay. Yep. Mm-hmm.
So these are the folks who basically decide what primary care is the most effective, the most important, and therefore needs to be covered by insurance plans as regulated by the ACA.
Right.
So kind of important, yeah?
Mm-hmm. Yeah, and not just what needs to be covered, but what needs to be covered without copays.
Boom.
Is my memory, right? Yeah. So this is like This is the other things that are so essential and that you really do not want to cause any barrier to access or people won't do it. And it's usually like the life-saving shit, like the really crucial screening and tests and vaccines, perhaps. I'm just going to take a wild guess and say that maybe vaccines is one of the elements of preventive services that is under the gun here.
Blah. Well, there you go. Yeah, absolutely. Right. Like, I mean, things like mammograms, depression screenings, colonoscopy, just really, I mean, anything you can think of that your doctor will do for you for free, or well, that your insurance company will allow your doctor to do for you for free while they pay and still make millions of dollars off of it. don't want to go down that rabbit hole, but the point is that these are like the most important, preventative health measures. And so he fired earlier this month. He fired doctors John Wong and Issa Davis, and they had been heading up the U.S. Preventative Services Task Force, and there was no explanation.
And I wonder who will replace them.
Oddly enough, RFK Jr. advised them to reapply. He sort of made this sound like it was kind of a regular oversight measure to go and fire committee members. Yeah, panel members.
Right. I think we all know what's going to happen here, right? They're going to be replaced by either, you get two choices. A, former Fox News host who was probably kicked out of Fox and disgraced for doing something or saying something that was beyond the pale even for Fox.
Right, or he worked for Epoch News now.
Yeah, exactly. Or you can choose door B, which is going to be former right-wing podcast hosts. Not that podcast hosts are incompetent or anything like that, or not fit for service in government office. I'm sure we would do amazing at that, but...
You know what, Ben? I'm actually sure we wouldn't do amazing at that.
Yeah,
I'm willing to actually put it out there. Maybe this should not be a career path, podcast to politics.
Are you saying we shouldn't apply for these open positions?
Oh, well, no, I didn't say that. Everybody needs a job. And who's
maybe we can do a campaign. Maybe we should all apply for these open positions.
I love that. I will find the idealist listing, and I'll report back to folks. I'll include it in the show notes. So obviously folks are worried because this is part of his general desire to sideline preventative care, most notably, as you point out, his real beef with vaccines.
Yeah, and we joke, but this stuff includes, especially for like babies, there's just a lot of really important preventive care that is usually co-payments are not allowed. So I don't know, the medical guidance changes pretty regularly about what's needed, just because what medicine can do changes from year to year. So I don't know. RFK against babies, is this the new campaign? I mean,
yes, RFK versus babies. Who wins? I don't know.
I see an AI video in our future.
Yeah, we'll do it in Lego, like the Iran.
Yeah, exactly. Yeah.
Like you said, like things change so quickly that they basically meet like every year, and they, kind of grade the science. I thought that was interesting. They actually assign a letter grade to it, and anything that gets a B or an A is generally required to be covered by insurers with no copay. So that's pretty cool. But except that they don't work anymore. Yep.
Yeah.
But
ironically, the Medicare for All bill would make everything have no copayments. So you wouldn't have to worry about this shit, this preventive care screening.
This is exactly where I was going, shockingly. I was going to bring that up. Like, one of the great benefits of Medicare for All would be that we wouldn't have to do this year by year haggling about what necessary healthcare we can afford to give people and what necessary healthcare we can afford to deny people. And it would cover all this great preventative care stuff as well. So you wouldn't have to worry about getting your mammogram or your colonoscopy or any of your embarrassing parts examined.
And two additional things to mention about these services. One, preventive care is very cheap. We do not spend much as a country on preventive care. Almost all the expensive shit comes at the back end, like when you're being treated for a very serious disease. Happens with hospital care, inpatient care, stuff where you're in the hospital for quite a long time or dealing with a very, very serious health issue. So the preventive care stuff is cheap. We could easily pay for it all without needing copays. But also, insurance companies do have a nice incentive not to have any even preventive care listed on the free, no copay list, because obviously, if there's a copay, fewer people use it and access that care, so they don't have to pay for it. They can still collect your premiums. And when you do access it, then you're paying a portion of it. Again, it doesn't cost very much, but that means that your copay of whatever, 10, 20, 50, God knows how much money, that you're paying a bigger and bigger chunk of the total cost of that care. So insurance companies must love intentional or unintentional incompetence on the part of RFK Jr.'s HHS administration, because it's surely saving them money and raking in more profits. So
this is probably a more in-depth question for a future episode, but do
Mhm.
we think that what's happening here, right? Is it just that RFK's obsession with vaccines is sort of intersecting with capitalist interests? Are they more intertwined than that? What's going on? Is it just that he happens to hate vaccines, so he got this job so that he could stop vaccines, and now that he's there, he's like, oh, let me have a circle jerk with all the insurance company people?
That's a profound question. I can't figure it out, to be honest. I mean,
Yeah.
the Maha crew does have kind of like an anti-big pharma, anti-big insurance narrative around it, but then when it comes to actually taking on big insurance and big pharma, I think maybe then you conflict with the Trump administration and Trump, who is, he's against big companies until they meet with him, and then he changes his mind.
Yeah, right.
So I don't know. I can't figure it out, but this is definitely not anti-corporate position here. So
doesn't really feel that way to me either.
no.
Glad you agree. Just surprise. we hardly ever agree on healthcare policy. Yeah, so RFK Jr. continues to make our lives more dangerous.
And it sounds like they haven't explained any of this, right? They haven't said why they're firing these people. It's just like,
absolutely, yeah.
Okay, yeah.
There's zero rationale and very little explanation of what's going to happen going forward. But folks who have been reporting on this have been pointing out that this is like a growing trend, that they've been sort of sidelining this panel, and in general, just just trying to make preventative care less accessible so more people die. So
sounds like a good idea to me.
Shitty pattern.
I just want to get that on the record for my application to be fast-tracked.
That's fantastic.
We'll do a pull quote.
If enough people like and share this episode, Ben and I will make like video applications like they used to do for Real World on MTV. Like, I'm Jillian and I'm here to be part of the preventative care task force.
That is a real generational reference right there. I think we're going to miss people on the high end and on the low end of age there.
Yikers. Yeah, that one was just for the Gen Xers. But Ben, let me tell you some more about some healthcare news.
Okay, what else? Well,
so this is not actually news, right? Like, because it's something that's happening that we all know about. If we pay bills, or if we get bills and shove them under a table and forget to open them
or lose them,
or throw them out without opening them because you already know that you can't pay what's inside. Okay.
Or if the dogs and cats eat them, first the dog eats them and then the cat eats them. Yeah. All sorts of things happen to bills.
My cell phone company is going to kill me if I try to come back at them one more time with my cat ate my bill. It's going to be a real issue. They're like,
it's a timeless excuse.
So, of course, the issue that I am referring to is the rising cost of healthcare. And obviously not a new thing, right? Like, we've known that healthcare costs have been going up for some time. When did healthcare costs start going up, Ben? Probably from the first time.
Forever and ever.
Probably from the first time that a doctor did something to a patient and thought, wow, I could charge money for that. So yeah, so the reporting that's coming out now, though, is giving us some numbers to put to that. And I know we don't love statistics on this show, but I do want to talk a little bit about it because it sort of feels like it validates things that we're being gaslit on all the time. So when Trump says healthcare is fine, we can look to the Millman Medical Index. You know the Millman Medical Index?
Millman, that sounds like a radical enterprise.
They are. Yeah, they're a bunch of. It's an anarcho-socialist commune.
Yes,
and, no.
Mm-hmm.
So it's actually an actuarial firm, and they've been doing. They do these annual sort of collections of statistics around healthcare. They are not radical folks, for as far as I know. They seem pretty kind of boring, like actuaries, which is like a compliment in this case. Like I wish more people who worked with numbers were boring. About it. Regardless, they did their data for 2026, and it's not so good, Ben. It's not
What's
so
happening?
good.
What's the price increase this year?
Okay, well, yeah. So the price increase is pretty bad, and the worst of it is for people who are on employer plans.
Well, that's not many people.
Given that our entire healthcare system is based on the premise that your employer should provide you with healthcare, that's a little bit of an issue. But long story short, they said the biggest driver of the of healthcare costs rising was prescription drugs. This is apparently often true, but especially because we got the Ozempic now. So all those GLP-1s are just driving up drug prices.
Okay. I see in my mind's eye the news narrative that will explain these price increases.
Go ahead.
Who are we going to blame for this?
Make the fat joke. Make the fat joke, Ben.
I was so tempted. No, not me. I'm not going to make the fat joke. It's the news. The news is going to talk about the fat tax. You know what's going to happen.
I really hope so, actually. I do hope people talk more about the fat tax. It's a real deal. And, I'm sick and tired of having to pay more for, everything. But especially my GLP-1s. But yeah. So yeah, obviously fat people are the problem here, and they should do something different. I don't know.
Do you know how much it's going up actually?
Yeah. So I wanted to go into this employer's cost shifting thing because that's the biggest, most crazy thing. So, all right. So I'm going to quote here: the healthcare cost for the average person with an employer-sponsored health insurance plan in 2026 is $8,460.
Okay. That sounds high.
It does sound high, doesn't it? My first thought is I can't afford that. And then my second thought was, that is 7.9% up, or $622 more than last year.
Oh, wow. Okay. That's a really, even in our history of large increases, that is kind of an extraordinary leap in employer-sponsored healthcare costs. That is.
Yeah. In point of fact, it is actually the highest year-over-year increase since the COVID-19 pandemic.
Huh. Yeah, and I imagine the high, very high, even if you go back 20 or 30 years. I can't remember. There have been leaps, but very rare that it's that high. That's
right.
Crazy.
Like it's usually like below 5, right? Like 3, 4, something like that. No.
Yeah, exactly. Here in Massachusetts, we have back in the 1990s during the tax revolts, there was a ballot question that passed that meant that cities and towns, municipalities, can only increase their taxes by 2.5% per year, I think. They mostly make money through real estate taxes. And that created this massive problem where, of course, cities and towns have to pay insurance for their municipal employees, and their insurance would go up more than 2.5% every year, but they could not increase their revenue by more than 2.5%. So the state was constantly having to bail out cities and towns because there was just like a structural impossibility to keep up with rising healthcare costs. So even, 3.5, 4% increases were unsustainable. Just thinking of cities and towns as like employers. But 8%, that's going to be, that's almost more than 3 times the amount of revenue that they're legally allowed to increase each year. And of course, everyone complains about the rising real estate taxes also.
Yeah, sure.
But it's all going straight to the insurance companies essentially. So yeah, that's a huge problem. I mean, cities and towns often have to cut their municipal services to be able to continue paying for these rising insurance costs. But it's going to be the same for every business as well. They're going to pass the costs on to the workers by making them pay for more, or cutting their wages, or increasing their wages less. So yeah, that's a disaster. It kind of happens behind the scenes. You don't really see the impacts. It's like, oh, your wages don't go up. You don't see that as like a pay cut necessarily, but it is a pay cut.
Right.
Because inflation goes up and your wage doesn't go up, and it's actually insurance companies stealing your wages. So yeah, 8% is a disaster. That's like a real fucking disaster.
Yes. And smart fellow, as predicted, right? Though we were always talking about this, the employers, some of whom may be good people, but employers are always going to shift those costs on to workers, right? So in 2005, employers paid about 61% of healthcare expenses for employees. In 2026, that share fell to 58%. And over that same period, employees' contributions increased by 6 percentage points to 27% this year. So it's just what you're describing, right? It's it's like an invisible pay cut or something. Yeah.
Employer-based insurance coverage is basically collapsing in front of our eyes. I mean, every time that number falls, like the employer percentage that's paid, I mean, we're almost under 50 now. So it's like already you're only getting half insurance on average, and everything else you're paying on your own. And as that continues following, basically employer insurance is doing less and less and less for us, and we're paying for it more and more out of pocket. So yeah, it is literally falling apart. And I think we should also add, for folks who want to blame GLP-1s for the increase, there's only one reason that those prescriptions are so expensive, and that's because we allow pharmaceutical companies to charge whatever they want, right? We give them a monopoly, essentially. Those GLP-1s cost nothing to make. I mean, they cost nothing. So
what does cost money, right, is research and development. And the fact is that the 90% of research and development on new drugs in this country is done on public money, right? Government funded research goes to universities, centers, that kind of thing, whatever. So we're essentially paying these people to sell us our research back.
Right. And remember, these are not actually new drugs. These are very old diabetes drugs.
True.
That have only been repurposed for weight loss. And most people, it's not like if you want a weight loss drug, you can get it covered by your insurance company. You need to show that there's a medical reason to receive insurance coverage in order to get that covered. So it's not like you get it for free automatically. No. It's only if there's a medical justification for it that it's covered. So
I mean, it also depends on what medical justification you have too. I wasn't going to actually talk about this, but what the fuck, right? I talk about everything else. So I am on Ozempic right now, and I'm more specifically, I'm on a compounded semaglutide, which is basically the online cheapo version of Ozempic that you have to buy if you can't get your insurance to cover it.
Okay, there we have it.
There we have it. And it turned out that actually, my doctor thought that it would be helpful. I've been going through some health stuff and thought it would be helpful for me to lose a little weight. And I was like, okay. At the same time, my partner was struggling with issues with diabetes. So we both got prescribed the same medicine
Mhm.
at the same time.
Mhm.
And he got his, apparently, diabetes is a really good excuse to take a GLP-1. Great.
Mhm. Mhm.
I don't,
Right.
I don't resent him for that. But yeah, sure. His insurance covers it. I think he pays like a $20 copay. And then
Mhm.
I pay $300 a month to some very, very shady online company where I mean, I don't even know. They send me literally a potion that they have mixed themselves, and a syringe, and
Right.
I inject it into myself. Anyway, point being, the way that they do these GLP-1s is designed to not provide healthcare.
Yeah. 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 I mean, that sounds like a high functioning healthcare system when you're going to the black market for your drugs. And
Yeah.
I think it's really best to just wait until you develop diabetes first, and then come back and ask for a GLP-1 coverage, right?
This is what I'm saying. This is what I'm saying.
Hmm.
And it was going to be really hard. I've never had problems with my sugar. My doctor was like, it's a real shame. I was like, oh. Oh, that.
Yeah.
Yeah. So anyway, GLP-1s, shout out to all of you who are on the journey with us.
Mhm.
So yeah.
And
Yeah.
one more
Mhm.
thing. I should say that maybe my information might be way out of date here, but it used to be that prescription drugs were, I mean, they were a decent chunk of total healthcare spending, but they were still like, I don't know, 15 to 20% of total spending. So it's possible that, the rise in prescription drugs was more than the rise of other types of care, but there's no way that an increase in prescription drugs accounts for even a big chunk of that 8% increase. It has to be all the other stuff as well. I mean,
I mean, that's what they
it's
love.
too small of a chunk. Yeah.
I feel like big healthcare as a whole, that they pick a new scapegoat every
Yeah.
year, right?
Exactly.
And
Yeah.
they all sort of agree on it, right? And they're like, okay,
Right.
insurance companies, hospitals, let's all blame big pharma this year. Next
Right.
year maybe the
Hmm.
device manufacturers will be the issue, or maybe
Yes.
it'll be the insurance companies' turn again.
Yeah.
But they
I
all
remember Alzheimer's one year was a new Alzheimer's
yes.
care was driving. Yeah. Yeah.
Mm-hmm, mm-hmm,
It's
mm-hmm.
whatever people are familiar with that's new that wasn't covered before is that fault, right?
Yeah, yeah.
Basically, any progress in medical care is the reason that our healthcare costs are rising. So
Oh, Ben. Oh, Ben.
we should
Um,
really resist progress in medical care. It's only
mm,
doing terrible things to us.
yeah, what are we supposed to be eating now? Like beef tallow or something? Jesus
Oh,
Christ.
the RFK Jr. diet.
Yeah, yeah. Yeah, I think actually the right wing is kind of doubling down on like the meat thing right now because they actually tried to slander James Tallarico by saying that he was a vegan, which is like, that's the most insulting thing you can say to a Texan.
Okay, that makes sense. Well, I did hear that meat is now at the base of the food pyramid. So
Let's all go out and have a steak. But first, I did want to tell you about one last piece
okay,
of news, Ben,
mm-hmm. Tell me.
before we go on. But this is a good one. This is a good one.
Mm-hmm.
Guess what? Medicare for all is pretty popular.
Okay, so we're at this. It's not full on depressing news updates. We get some good shit.
Honestly, if that hadn't been a story for this week, I would have had to make it up because it was pretty
Yeah, yeah,
depressing.
okay.
But no, I didn't
Thank you.
actually make it up. It was the Medicare for All PAC. They did the most
Yeah, yeah.
recent polling on this, and they found out that over 50% of voters expressed support for
Hmm.
single payer Medicare for all healthcare.
Yeah.
Mhm. And yeah, I mean, I don't know really what to say about this because this is another thing that's not news, right? Because Medicare for all has always been pretty popular.
Yeah, no, this is true. And of all the news stories you've mentioned today, this is the one that I actually did follow and did see.
Mm,
And I was looking at the Medicare for All PAC webpage on this poll.
mhm,
And I
mhm.
guess the one interesting thing that it added that hasn't been in every single Medicare for All poll we've seen is they did a poll that looked at national support, like likely voters nationally, but they also looked at battleground states, Republican-leaning battleground states.
Yes.
And interestingly, the level of support for Medicare for All was basically identical in Republican-leaning battleground districts and nationally.
Yeah.
So national, 36% strongly support Medicare for All, 18% somewhat support it, 36% in battlegrounds strongly support, and 20% slightly more somewhat support it. It does feel like the strong opinions are also getting a little calcified here, like 36% strongly support and 32% strongly oppose. So we're having like a shrinking window in the middle. People are, I think, getting more familiar with Medicare for All and know what it's all about. But yeah, that's, I mean, Democrats all, at least, Democratic centrists, like, from the, whatever it is,
Don't name any names. No, just kidding.
Okay. Like the Democratic National Committee and, just like the
DLC
really,
and the
exactly. Yeah, exactly. And whatever the Senate fund that funds that funds the Democratic Senate candidates, they always say you have to lean to the center on healthcare if you're running in a battleground state, because they just assume, that the swing voters there will not accept Medicare for All. It's considered too left wing. It's like progressive. It's like a tag for you're a progressive and a lefty. But it's just not the case when you actually look at these districts. And in fact, it's really interesting to see polling that there's literally no difference whatsoever on this issue between kind of more centrist leaning battleground districts and the rest of us. So.
I kind of feel like this is like a victory for, well, definitely for us, but mostly for, I mean, this is like yeah, I think this is a victory for folks who have consistently argued that this actually isn't a political issue. You know what I mean?
Yeah.
Like there are lots of good socialist reasons to do this. There are lots of good Dem reasons to do this. And there are a lot of good evil capitalist reasons to do this, So I think that folks are, I think it's becoming more obvious, right? That folks across the spectrum, right, are interested in Medicare for All as a solution. Yeah, absolutely. I was also I was really interested in one of the critiques that we sometimes get as part of the Medicare for All movement. When people think of Medicare for All, the most prominent face I think they imagine is Bernie Sanders. And I think there was, we've talked about this in the past, right? Like there was a certain kind of perception that this was an issue for like nerdy white leftists to care about and nobody else gives a shit. And this is all just like, commies like me or whatever, whatever. But what we see here is actually that like support for Medicare for All is strongest among Black Americans. 77% of Black Americans support Medicare for All. 71% of women under age 50 and 74% of those under 30 for folks who were worried that we were losing the youth. So across demographics, like people are engaged, people are excited. And that is actually the reason that at Healthcare Now, we're going to be doing a little bit of action this summer, Ben. You want me to tell you?
Sweet. What's in the pipeline?
All right. So, like I said, this is our moment, right? We've got all this shit going on. It's awesome. It's going great. We're very excited. People are, there's momentum and we're capitalizing on it. And so the way that we're doing that is that we are going to be having no surrender summer. We don't give up. Okay. We don't give up. When it comes to healthcare, we don't give up. This is the summer to really lay it all out on the line, make it clear that Medicare for All is the solution that we want and that we are not going to rest until we get it. And so things are kicking off. We have a petition from the national nurses to sign that folks can sign. And that's one of our, I like to give the things that take 5 minutes first, right? So, and then with more investment in time, we've got a series of trainings coming up at Healthcare Now. We've got actions coming up. We're going to have some exciting delegation visits and then a big birthday party for Medicare. in July. So we are very, very excited to get ramped up for that. And the thing that's kicking it off is this really cool thing, and that's where Cleve Jones comes in, right? So Cleve Jones, the guy who invented the AIDS quilt, and is totally amazing. I mean, this guy's like an expert, right? Like the AIDS quilt, we all remember the AIDS quilt. It's, something that like, just like it's the visual image, at least for me, it's the visual image of the AIDS crisis, right? So this guy knows something about taking an issue that could otherwise be invisible, an issue that could be statistical, and just like putting a human face on it and making it something that people can see and touch, right? So he came up with this idea to do 7 days in June. And so we are going to be doing a week of activities, and they're going to be going on. It's a distributed action. You can still add to their website. We'll put it up in the show notes and everything. You still add an action, and these actions are amazing. They're happening all over the country. It's big things, small things. One of the things I talked to Cleve about in the interview is, that there's in the Midwest, there's a group of tenants in an apartment building who have started an event, and it's just a vigil. It's just them. They're just going to get together and have a vigil for folks who have passed. And it's like, that's the shit, So without further ado, I would really love to share with folks this super awesome interview with Cleve.
All right. Can't wait to watch.
Thank you so much, Ben. I'll see you next time.
All right. See y'all next time.
Hello, friends. I am so lucky today to be here with Cleve Jones, the icon, the legend. He's an amazing, don't roll your eyes at me, Cleve. He's an amazing activist. You probably remember him as the founder of the NAMES AIDS Memorial Quilt Project, which became one of the most important public education tools for teaching people about the AIDS epidemic. He is also the founder of the San Francisco AIDS Foundation, a really important organization. And his new project is 7 Days in June, which is a national call to action that we at Healthcare Now are really excited to be a part of. So really excited to have you on and talk a little bit about how you got here.
Well, thanks, Jillian. I guess the short version of my long life is that, back in the late 60s, I was a very frightened little gay boy in Phoenix, Arizona, who didn't know that there was anybody else in the world who was like me. Certainly didn't know there was a community, and I certainly didn't know there was a movement. But I did know there was a movement for peace and social justice, and I was very much influenced by the work to try to stop the Vietnam War, the early women's movement, the civil rights movement. Those were the images on the television as I was a child. And my family's values met with the movement's values. So I grew up in a family that revered Dr. King, for example, and marched against the war and for the Equal Rights Amendment. And then in 1969, Stonewall happened, but I didn't hear about it. I was still in high school. I didn't hear about it until 1971. I read about it in Life magazine, and I got the hell out of Phoenix and hitchhiked to San Francisco. I just by chance met some of the greatest pioneers of the movement, the community we now call LGBTQ+, and one of them was Harvey Milk, and he mentored me and persuaded me to go back to school, bribed me with an internship. 11 months with him, and then of course he was murdered, and there was a lot of upheaval, and out of that I got a job working in the California State Assembly as a legislative assistant assigned to the Health Committee. And it was there 45 years ago, next week, that I read on June 5th, 1981, the first account in the Morbidity and Mortality Weekly Report from Centers for Disease Control about these clusters of gay men in San Francisco and LA who were dying. And that was June of 81. By the fall of 1985, almost everyone I knew was dead or dying or caring for someone who was dying.
Yeah.
And I helped organize and fight back and helped co-founded the San Francisco AIDS Foundation, had the idea of the AIDS Memorial Quilt in 1985, launched it in 1987. It then became the world's largest community arts project. I still
Yeah.
can't sew, but it worked. And for the last 20 years, I've been working primarily within the labor movement with a union called Unite Here, which is
Oh,
the
sweet.
hospitality workers union, food service, gaming. Think of the housekeepers in the hotels. They are the backbone of our union.
Mm-hmm.
Membership is mostly female, mostly immigrant, women of color. And I love the work because it's always different, every year a new challenge. But when we win, and we win, the workers in those properties go home with more money in their pockets. They've got better health care. They've got the opportunity to put their kids through college. They're treated with more respect on the job, and they work under safer working conditions. So it's a very rewarding job. And I'm 71, and the last 6 months or so, I've been focused on this new effort to try to help people understand the devastation that's going to impact all of our communities as a result of HR 1, the $1 trillion cuts to Medicaid, and the general chaos that this administration has unleashed.
Absolutely. And I want to go into that in just a minute, and we'll talk a little bit about what's going to be happening for 7 days in June. But before we do, I guess here on the Medicare for All podcast and at Healthcare Now in general, like, we're committed to storytelling as really the heart of our theory of change, right? We know that stories are what convince people. And as I was thinking about having you here today, I thought about my own weird experience being introduced to the AIDS epidemic. I grew up in a very, very conservative town, but a 12-year-old boy died of AIDS very, very early on in the epidemic. Mike Sheehy, I want to say his name, rest in peace. So in my very conservative town, folks attached his face to the AIDS epidemic. And so they thought of it not as, all the terrible things that people were calling it at the time, cancer, all sorts of awful things. They thought of it as our cause, our disease. And it all came out of that one thing of just having that one kid. And it just occurred to me that really what you did with the AIDS quilt project was really that multiplied by a billion, right? It's like all these individual stories, putting a human face on all of these crises. And I wondered, about what lessons that's given you for today, and for our fight for, human dignity going forward.
Well, you hit the nail on the head. That's exactly what it's all about. When we read these statistics, and right now there's some really frightening new numbers coming out of Africa where it's clear we have an Ebola outbreak. We have our own scary numbers here in the United States. It's not just the $1 trillion cut from Medicaid, but it's, I think, the 2,000 cases of measles, which we declared eradicated, many years ago. So the numbers are numbing, don't convey the humanity. But when you pull back a little bit and look at the individual stories, the individual struggles, the struggles of specific families, and what you described about the young person with HIV in your community is actually I've heard versions of that from all across the world where people,
I'm guessing,
one local hero brought it home to that community. It's very important.
Yeah. So, I mean, you're taking that kind of spirit, I think, into 7 days in June. So do you want to talk a little bit? Well, do you want to just, I haven't gone into what's happening. I wanted to save that for you.
Oh, sure. The website is 7 Days in June, all spelled out, 7daysinjune.org. And this began back in December when the president decided to cancel World AIDS Day. And it was such a petty and stupid move on his part, really mean-spirited, but it paled in comparison to what he had allowed Elon Musk to do earlier, which was to destroy USAID and doom hundreds of thousands of people who have died since then as a direct result of those cuts.
That's right.
So I called up my old buddy Sean Strube, who is the former mayor of Milford, Pennsylvania. He came out back up New York. He's my age. We've seen a lot. And then we started thinking about this anniversary that's coming up next week of 45 years, 45 million dead, still no vaccine, still no cure. But for people who might be watching this who don't know, we came very close to getting to an end of new HIV transmissions through treatment as prevention. People like myself who are being successfully treated can no longer transmit the disease. And people who are not who are HIV negative can protect themselves with a daily dose. And now, thanks to advances in medical science, 2 injections a year can confer 99.999% protection from acquiring this virus. So at that precise moment when medical science brought us to the brink of some kind of victory against HIV, instead, the actions of this administration have put us on the precipice of a whole new wave of infection. So we started reaching out to the HIV/AIDS organization saying, how do we observe this awful milestone anniversary? And almost everyone said, well, we got to do that, but it's bigger than HIV/AIDS. It's bigger than us. It's bigger than our communities. It's the whole thing. It's a disaster. It's a catastrophe.
Yeah.
And the passage in particular of H.R. 1, the so-called Big Beautiful Bill, which is actually a big nightmare. And then we started really beginning to comprehend how few Americans understand what is about to happen because they deliberately, as you know, delayed
Absolutely,
the
yeah.
impact of that bill until after the midterm. So a year from now, we're going to see hundreds of hospitals that have already closed. We're going to see patients abandoned, employees dismissed. It's going to affect everybody. And they did it in the, deliberately to conceal it until after we had a chance to vote. So our mission is to make sure that before the midterm elections, as many Americans as possible understand exactly what was in that bill and the impact it's going to have on their local communities.
Yeah, that's awesome. And one of the ways that's happening, right, is that during this is a decentralized, distributed week of action, right? And folks are setting up actions in their local towns that go from, there are some that are going to be big rallies, and then there are some that are going to be, an apartment building getting together, tenants in an apartment building getting together to hold a vigil for folks who have passed, and I love that so much. Do you want to tell me about what some of your favorite kind of actions that have been popping up now as folks have been signing up and getting involved?
They're happening all over, and you're right, it's decentralized. I can't tell the people of Pike County, Pennsylvania, what's the best message for their community or the best message. I can't tell the people in Ogden, Utah, or Bakersfield, California, but they know what to do. They know who to reach out to. So there's all sorts of events that are happening, but there's a few things we've been trying to emphasize. One is that first of all, to educate people on the local impact of the federal cuts and the clawbacks and the chaos and the policy intrusions, all of that. Secondly, of course, candidate nights. You got to confront, and June is the month with the most primary elections leading into the midterm. So candidates up and down the ballot, regardless of affiliation, need to be confronted and put on record. But also, Americans are tired of this constant negativity and the drumbeat of bad news. And part of what we want folks to understand is that, in fact, we know how to build a healthy nation. We know you can do it. They're the people that go to work every morning and work hard into the night, often underpaid, sometimes dismal working conditions. We're talking about doctors and nurses, of course, but also the phlebotomist that knows how to take your kid's blood without making her cry. The researchers who are scrambling right now to preserve data that has proven inconvenient to the current administration's ideology, the custodial staff who keeps the hospital floors clean, the cafeteria workers who prepare the food for the staff and the patients. There are healthcare heroes in every single community, and we're excited to see people shining a light on them and thanking them and elevating them. Another part of this that I think is very important is that Elon Musk and other parts of the administration, other people within the administration have gone on television and told the American people that compassion and empathy are weaknesses. Imagine this. I mean, it's really quite an extraordinary message, and that is contrary to the traditions of every faith practiced in this nation. So we want to really encourage for people of faith, for communities of faith, to create acts of interfaith solidarity to say that no, compassion and empathy are central to our faiths, and we believe that we are called to protect the most vulnerable within our society, and that in fact that is the greatest possible measure of a society. So that is happening, and And of course, we don't want to lose sight of what happened with AIDS, not just because I lost all my friends, but because there were lessons we should have learned from that. And a
Yes.
71-year-old man, I got to tell you, it's hard not to be angry, having lived through 2 pandemics now, both of which impacted my life greatly, and see the same stupid mistakes play out again and again and again. And it's a long list, and we probably don't have time to get into it. At the top of that list is the racial disparity, the fact that Black
Yeah.
and brown communities, Black and brown bodies are more likely to suffer, less likely to receive preventative care, more likely to be hospitalized, more likely to lose their lives. So we saw that happen with HIV/AIDS. We saw it happen with COVID, and I'm afraid we're going to see it even more brutally in the months and years ahead, thanks to this bill, HR 1.
Yeah, absolutely. Well, I hope that you know that those of us who are, working at organizations that are fighting this, and we're definitely listening to and trying to learn from the lessons of the work that you and all your comrades did. We really appreciate it. And so I know you have to go and you have lots of media work to do. And I know you have some famous friends you're probably recording with today, some of the celebrity spokespeople for 7 days in June.
Actually, at the top of my list today is to clean the house and do my laundry.
Oh, wow. You're 2 steps ahead of me, man. Well, I really appreciate you coming today. Before you leave, what's one thing that we can hold on to? How do we hold on to hope in this moment? What's just one short thing that I can say to myself before I go to bed?
It almost feels trite and perhaps the stuff of commencement speeches, but the reality is every one of us can make a difference. Every one of us has something special we can bring to the struggle. I would encourage anybody who hears this to look deep within themselves and consider, what are your skills? What are you good at? What can you do in this struggle that brings you joy?
Yeah.
And I'll tell you, I've done a lot of things in my life, but I think perhaps the most remarkable is that I've endured. And I've endured and I've kept going because I like it. You don't have to for it. I mean, I'm quite serious. I found a way to, hopefully, I think I've contributed, but it's in a way that brings me joy and connects me to wonderful, smart people who actually give a damn. And that's a great gift.
That's amazing. Thank you so much again. But yeah, I'm still going to keep thanking you. I can't help it. I really appreciate that. And yeah, let's carry that forward. Let's all think about how we can seek joy and justice. Thank you very much.
Thank you. Be well.
All right, folks. Thank you so much for being with us here today on the Medicare for All podcast. Thank you so much to Cleve, of course, for stopping by, and big hellos to all of our favorite folks, including our podcast team, and especially our audio editor, Craig Stanton. We want to remember to like, subscribe, comment, and share this episode with your friends. This podcast is a project of the Healthcare Now Education Fund, and you can support the pod by going to www.healthcare.now.org and click on the donate tab to send us some love. Thank you so much, folks. Stay safe and stay dangerous.